Hey everybody, it's Medicare Dave, and I just wanted to make a quick little video showing you how to choose the best prescription drug plan for your needs. This is a question that I'm commonly asked. What is the best drug plan out there? In the state of Florida, where I live, there are 27 different prescription drug plans. The best drug plan is really whatever drug plan gets you your unique list of prescriptions for the least amount of money out of pocket. Sometimes a husband and wife living in the same house, I might recommend two totally different drug plans for them because one of them might be taking a few generic drugs and the other one might have some more extensive medication. So here's an easy way for us to utilize the Medicare.gov website, and I'm going to go through and show you exactly how to do that. Let me minimize my face. We're going to go to Medicare.gov in the address bar. Click on this box that says Find 2020 Health and Drug Plans. If you've already logged in and created a Medicare.gov account, go ahead and log in right there. And this will save your drug plan on your Medicare.gov portal. If not, or if you just want to look very quickly, you can click Continue without logging in. Let's move me out of the way. Click Part D drug plan, enter your zip code, 33441 is where I live. And if you're receiving Medicaid, extra help, or supplemental security income, go ahead and check whichever box applies. For most of us, we're just going to choose I don't get any help from these programs. Click Next. You're going to want to see your drug costs when you compare the plans. And they ask, how do you normally fill your prescriptions, either at a retail pharmacy, a mail order pharmacy, or both? I typically like to put both in there just so that we can see all of the different possibilities. Go ahead and click Next. And here's where you can enter your drugs in. So let's put a couple drugs. Let's put Cinepril, let's say 5 milligrams, once a day, or 30 a month. If it's twice a day, 60 a month. That's what you're going to want to put in. Let's say metformin. And look, sometimes you'll start typing and you won't see it, but if you continue typing, it should populate with what you're looking for. So 500 milligrams, twice a day. Okay. Let's say you take the generic form of Crestor, which is rosuvastatin. You can either start typing rosuvastatin in, or you can start putting Crestor in. Once you find Crestor, click Add Drug. It'll ask you if you want to use the generic version or the name brand, and you have your choice of selecting either or. And 10 milligrams once a day. Now let's put another drug that's a higher tier or a name brand drug. Let's say we're going to go with Janumet. Okay. Put your milligrams in, add drug. You can continue adding drugs until your list is complete. Once you're done, click Done Adding Drugs. Now we can see on the bottom of the screen that's already put in the mail order pharmacy. It's going to give you the opportunity to compare and select two more pharmacies. Now every drug plan has preferred pharmacies for that plan and standard pharmacies for that plan. You can typically use any pharmacy that you want to get your drugs filled, but if you use a preferred pharmacy for that drug plan, you're going to get the lowest copays. So typically what I will do is I will select either CVS and Walgreens. Typically with all of the different drug plans, usually CVS and Walgreens will be one of the preferred drug plans for most of the drug plans in your, I'm sorry, CVS and Walgreens will be one of the preferred pharmacies for most of the drug plans in your area. So that's a good place to start. Obviously, if you have a pharmacy that you prefer going to, then put that pharmacy in, and then also select for comparison purposes either CVS or Walgreens. Go ahead and click Done. And you have three different ways of sorting your plans by the lowest monthly premium, the lowest drug deductible, or the lowest drug plus premium cost. This is the best way to sort your plan because some drug plans have a low monthly premium but high copays for your drugs. Other drug plans have higher monthly premiums but lower copays. We want to put all of that together and take that all into account and find out which drug plan for the year, premiums plus copays, is the least amount of money for you. And we can see that Mutual of Omaha comes up first. They have a retail cost. This is the cost of your premiums plus the cost of your drugs at a retail pharmacy is $861 for the year, and the mail order pharmacy is $841 for the year. If we go to the next plan on the list, Cigna, we'll see that the retail pharmacy cost is $867, so it's a little bit more than Mutual of Omaha. And let me move myself out of the way. The mail order pharmacy cost is quite a bit more than Mutual of Omaha. And if we go down, we can see that the retail cost continues to go up for each plan as we continue going down the list. So Mutual of Omaha would most likely be my best recommendation based on this set of prescriptions. What you can do is you can compare several different plans side by side. And if you click on that, it'll give you a comparison report where you can scroll down and you can see the different costs side by side of these plans at the pharmacies. You can also click on the print logo and print out or save these printouts as a PDF, which might be good for your files. We can go back and I don't want to compare anymore. What I want to do is look at the details of this particular plan. This is the Mutual of Omaha plan. It has a monthly premium of $25.80. It has a annual drug deductible of $435. Now, the drug deductible confuses a lot of people. The deductible only applies typically to tier 3 and tier 4 drugs. Most drug plans are set up the same way. They break down the different prescriptions based on the tier. A tier 1 drug would be your preferred generics. Those are going to be the least expensive. A tier 2 drug is going to be a non-preferred generic. Your tier 3 will be a preferred name brand. A tier 4 will be a non-preferred name brand. If we scroll all the way down to the bottom, we can see the different tiers of these drugs. We see that metformin and lisinopril are both tier 1 drugs. Rosuvastatin is a tier 2 drug, and Janumet is a tier 3 drug. If you go up to the cost at CVS, we'll see that they break the different drug prices into different stages. You have the retail cost of the drug. That's what the drug actually costs without the drug plan. You have the cost of the drug before your annual drug deductible has been reached, the cost after the drug deductible has been reached, the cost in the coverage gap, which is also known as the donut hole. And for more information on that, I would encourage you to just go to Google, excuse me, type in Medicare donut hole or Medicare coverage gap, and just read the description of how the donut hole works. Then you have the cost after the coverage gap. You'll notice that lisinopril and metformin, the 2 tier 1 drugs, have a cost of 0 copay at the pharmacy, both before the deductible has been reached, after the deductible has been reached, in the coverage gap, and it goes up after the coverage gap. They're not affected by the deductible. You'll notice that Janumet has a cost of $465, which is the full cost of that drug before the deductible has been met, and then it drops down to $25 after the deductible has been met. So you'll notice that the tier 1 and tier 2 drugs are not affected by the drug deductible. The tier 3 and tier 4 drugs are. If you scroll down here, you can notice that in May, the cost of your drug is going to be, the total cost of your drugs is $462, which is the $435 deductible plus the cost of Janumet after you've reached the deductible, plus the $2 for rosuvastatin. That equals $462 for May, and then you'll notice for the rest of the year, your cost is $25 because you're paying a $25 copay for Janumet, a $2 copay for rosuvastatin, and $0 for lisinopril and metformin. Once you decide that this is the drug plan that you want, you can simply click the enroll button here, start, and fill out the application with your data. And that's how you enroll in the drug plan. Now, certainly this is all confusing. If you have questions about this at all, definitely feel free to reach out to me. I'll walk through this whole process with you side by side and do the whole comparison with you and even help you with the enrollment if you need that, so that you make sure you're getting the best drug plan for your needs. If you like this video, you found it helpful, please click like on Facebook, on our Facebook group, and please, I encourage you to add your comments. Let's all talk, ask questions if there's anything confusing. And if there's any questions that you have that you'd like to have me address on an upcoming video, please ask me in the comment section and I'll make a video specifically for you. Thanks, and look forward to speaking with you soon.